To kick off our show, we welcome in from Advanced Behavioral Rehabilitation, Dr. Bryan Weinstein. Bryan, how are you?
Thank you.
Welcome to JTD.
Thank you. It's a pleasure to be here.
Yeah, welcome to Jackson.
Thank you.
Your practice is in the Metro Detroit area.
Right, that's correct. Yes, I do psychopharmacology, rehabilitation, and psychotherapy, all through 2 offices, one in Livonia and one in Birmingham.
And there's frequently a requirement by the courts for someone who goes through the system and violates drug and alcohol laws to get some help.
That's correct. Yes.
And that's where you come in.
Yes. Yes.
Unfortunately, it sounds like it's a growing business.
Unfortunately, it makes you wonder why that is, and are we really on the right track, or are we off the track, and do we have to find a different track to get on?
Is it fairly recent that courts are requiring something to occur after a typical sentence?
Not so recent. I mean, they've been doing that for quite a while. The problem is that, it's kind of a little bit of a Wild West in terms of who's providing those services. There's not a lot of accountability, and basically anybody can set up shop and say that, we're going to provide those services, and they end up having relationships with whether it's probation officers or court systems, and I think that the whole system could be a little more tightened up and a little more validated.
And I think one way you're doing that, you're inviting judges and other participants in the legal system to come in and see how you do what you do.
Absolutely, right, yeah. And it's just really critical that we use, that everything that we, impart to our clients, to people who get in trouble, has, validity to it, is measured in the sciences of psychiatry and psychology, behavioral medicine, and that in addition to all of that, just to be a real humble company and to really listen to society and listen to the judges and the attorneys and the probation officers, and what are they seeing, what kind of input do they have for us. So we're really, we really run a company where we're a real open book, very humble, and we try to figure out, how can we help people.
How long have you been operating this firm?
Close to 10 years now. Yeah.
And in those 10 years, are you able to track your success? Is there recidivism in the population that you reach?
Right. So we are tracking that, and we're finding that we're doing a pretty good job. We treat a variety of problems, anywhere from dangerous driving to substance abuse, retail theft, domestic violence. So we treat a really wide variety, and so each thing that we do has a different recidivism rate. But certainly we're seeing some pretty nice outcomes.
We were at, I mentioned earlier, the Aware Shelter program this morning, and domestic violence, that is one area where that they say it's a lifetime for people that are perpetrators. It's a hard behavior to change.
Right. And so, whether it's domestic violence or dangerous driving or substance abuse behaviors, it's really critical, and why advanced behavioral rehabilitation really was conceived, is that, you really have to pay attention to the underlying mechanisms of what people do and why they do it. It's not for the sake of that event. It's for the sake of, there's underlying psychiatric, psychological mechanisms that exist. We really have to pay attention to that. Otherwise, we're just doing nothing but negative reinforcement, punishment. Jails are going to be overcrowded, and we're really not going to get anywhere. So we really have to start looking at a different approach.
I would imagine there's one thing in common, that all of these people, whether they're have problems with alcohol or drugs or domestic violence, they're not happy people to begin with, are they?
Right. No, they're not happy people, and more desperate than that, they're lonely people. They're people who feel hopeless. They're people who feel that there's not really a listening ear out there for them, who don't understand them. They're conflicted. Many times it's a genetic thing, whether it's generalized anxiety disorders that lead to alcoholism, or whether it's mania or ADD, all these things we hear about. But all these things lead to substance abuse behaviors or impulsive activities, or I can go on and on. And if we don't pay attention to those underlying mechanisms, we're really left with their only care becomes the judge, and they get in trouble and they go through a rotating system, and things really don't evolve.
How much harder does it make your job? Because these people, in many cases, probably aren't willing to dispense. Like, they're not there to, hey, I'm here to lose weight, I'm here to quit smoking. They're here because they've been ordered to.
Right, that's correct. So, and really that's what we try to impart on the judicial system, that unfortunately, they really are the first line of defense. People don't wake up and say, I've got problems, I got conflicts, I don't know how to resolve them. I think I'll call my local psychiatrist, or I'll call my local, psychologist. It just doesn't work that way. So, unfortunately, and this is a really, they end up getting in trouble. They end up doing something, stupid, or they end up just doing something that causes them to get in front of a judge. And so, for the judicial system really has that first event to either take control of that opportunity and do the right thing and look at it and get them involved in the mental health system, or squander that opportunity.
And you talk to judges, and I know they go through your courses. And what kind of response do you get from the judges in that example after they have been through your?
Yeah, I mean, I think it's usually very, very positive. And unfortunately, judges and probation officers in the court system and the judicial system, they have their problems in terms of, gee, this guy, for instance, just spent a lot of money on, the legal system. He doesn't have any money. You can't really afford to get to these classes or get to these professionals. And what do we do? How do we court order them to take more and pay for more services? And it's a real problem for the judge. On one hand, they don't want to create more burden. On the other hand, they truly do want to make the attempt to help these individuals. So, they have their hands full with making the right decisions.
You have different levels of service and different levels of programs. How do you determine where someone is to end up?
Well, that's a tough call. And when I first started the company, and I borrowed from many of the programs in the country and what was important. I mean, look, I would like to put people in really longer term treatments, but there's realities. So, the determination is sometimes based on, severity of what happens to people when they get in trouble. So first offenders may take just an insight-oriented course that might be about 2 or 3 hours, that really gets them in front of a psychological mirror, if you will, to help them understand the road they're headed down, and maybe they had done this for other reasons, and to really take hold of this now. So more of the severe, problems with the law, of course, they take the more intensive courses.
Is there a difference in someone that says, I've got to kick this habit and I need help, and the person that is there because it's part of their sentence?
Yeah, I mean, of course there's those differences, but it's really fascinating when properly confronted with, again, a great deal of humility and care. Even the ones who put up those mechanisms of denial and those defensive mechanisms, and they're really initially obviously forced to take these classes, and they really don't want to. But when they're confronted with these things and they realize that, hey, wait a minute, I really do have some kind of underlying problem, and or people actually care about me, and people are willing to listen to me, and people are willing to understand me a little bit. It's pretty amazing how a lot of these defenses go down.
Not only do you and your team conduct these sessions, but you also train other people and other firms in how to do this.
That's correct. Yes, we do. And we're embarking on trying to, grow and trying to train as many professionals as we can, whether it's whoever wants to really be involved. We would love to, grow this company and try to train people even in other states. Where they can just, be a part of the ABR system and really just get out there and branch out and get in front of the judicial system so that they can offer this level of care.
Yeah, I don't think we have anything like this in Jackson.
Right.
So it's not something every community has.
No, it's really not part. In fact, I started this because I was just amazed at, obviously, the problem. There's so many people that get in trouble or do things that, are really regretful, and the level of opportunities that are out there in terms of caring for these people. And again, understanding them not from a negative, again, not from a judicial standpoint, but more from a healing standpoint, from a standpoint of understanding their underlying mechanisms, behavioral mechanisms, psychiatric mechanisms. So there wasn't enough out there, and I created this company because I felt that there should be.
We actually have a clip from one of your training sessions.
Okay.
So let's listen in and take a look.
For many, getting in trouble with the law is a psychological cry for help. Either a person has a poor way of coping through life's stressors, or they have an underlying psychological or psychiatric condition that predisposes them towards maladaptive patterns of behavior. I believe the justice system has a responsibility to both protect but also to recognize the opportunity to help a person if they break the law. Those individuals who break the law don't wake up in the morning with insight saying, I want to call my local psychologist. They do not recognize that their behavior may have an underlying component that is treatable or better understood. The justice system just may be their first stop in a journey of healing. I started Advanced Behavioral Rehabilitation as an answer to a question. Can a behavioral company exist for the judicial system that provides enough education so as to promote insight and awareness for those individuals who get in trouble? The answer is yes. We've developed and have incorporated scientifically proven psychological material that is promoted through a classroom setting by highly trained individuals in the fields of psychology and behavioral change. This level of clinically based education, along with technology and company systems for accountability, has allowed Advanced Behavioral Rehabilitation to offer superior behavioral services. We are empathic and therapeutically oriented, and we embrace true change. Advanced Behavioral Rehabilitation stands out because we have developed our material from the many disciplines of psychology and psychiatry. This includes cognitive behavioral psychology, motivational psychology, insight-oriented psychology, addictionology, and biological psychiatry. We also embrace technology in the form of driving monitoring devices, driving simulators, or online courses. The truth is that Advanced Behavioral Rehabilitation is the only company owned and directed by a psychiatrist. Our company will be known as a personal responsibility company. We are hoping that a classroom setting is just the beginning for people who have so much to offer, but who need a hand at figuring it out. Our technology department is also growing. We will be developing and offering webinars and online courses for our clients. I am so excited about the development and growth of this company. I am so happy to have amazing individuals who care so deeply in the process of behavioral change and in saving lives. We hope you all enjoy this journey.
Well, that's pretty cool. And you make a point that you're the only company with a psychiatrist that heads up the program.
Right.
And that's, I think, a pretty critical, important difference.
Absolutely.
I would think that these kinds of services would be very expensive.
They're really not. We're talking about, initial courses are anywhere from $50 to $90 for 2-3 hour courses. They're really not that expensive. They're a lot cheaper than paying a lawyer.
Yeah.
For extensive legal fees that if you get in trouble. So again, these are preventative mechanisms. I mean, it's hopefully a couple of these courses can really begin to give you enough insight to want to get better. Yeah.
Well, we were talking about embezzlement earlier, but that's one area that you will also work with.
It's really fascinating when you look at how a lot of people get in trouble with the law. Many behaviors are very impulsive. People are not actually thinking about their behaviors. They're reactive. The person who gets pulled over with a DUI didn't necessarily plan on even drinking that much, or didn't really plan on the event where they made the decision to get in a car or not get in a car. It's these kind of things. So there's a lot of impulsive behaviors. When we talk about embezzlement, that's actually somebody really, really thinking about it, right? And there's a lot of intent go on. That's a little more sociopathic, if you will, and there needs to be a lot more a large degree of understanding in terms of why a person does those things. But again, there's even in those cases, there's psychological underpinnings. Absolutely.
Yeah, and some of those, it's an opportunity. Someone gives them the checkbook for, to write that suddenly the amount of drug, heroin, is such a big problem in our state.
Right.
Does that then affect your business?
It is a big problem. You're absolutely correct, and heroin kills people. So it's and then of course you get into prescription drug abuse. Prescription drug abuse again is in the same category as heroin. Those are opiates. These things stop people from breathing. So just because there's a prescription out there and it was written by a doctor doesn't necessarily mean it's safe. And these kids are out there. They're not educated to know what's safe or not safe. To them, it's simply a drug that you party with, and it really becomes a problem. And there needs to be a lot of education out there. And for the kids or other adults who abuse these drugs, again, they're self-medicating, and they're masking or self-treating, again, self-medicating underlying problems, whether it's anxiety disorders, depressive disorders, psychotic disorders, personality disorders. There's a lot of problems that, the general population suffers. Anywhere from 5 to 20% of the general population, will suffer from some kind of psychological or psychiatric event. And again, they don't always have the insight to know that they need care.
Wow. Well, you've got quite a fascinating firm and practice. If someone's interested in learning more or even having you come speak, how do they get hold of you?
Well, they can look us up online, through ABR.com, and they could probably call you, and you'll give them our number.
We can do that.
There's certainly ways to reach us.
We appreciate you coming over, and thanks for coming in today.
It's my pleasure. Thanks. Thank you.
The founder of Advanced Behavioral Rehabilitation, Dr. Bryan Weinstein. Thanks, Bryan.
Thank you.